Tyler, and like you said, I couldn't agree more. I don't know if there's anything that anyone can be done. Even if we were to shut it down, I feel our social structure altogether has been poisoned for so long. Correct. Correct. Our social system has been poisoned for so long. The reason our social systems have been poisoned for so long is because the cultural institutions that make up society have been destroyed completely. Additionally, and I'm going to go a little nonprofit on everybody here, the two types of what's called anchor institutions. These are institutions that communities have a tendency to build themselves around. The two types of anchor institutions in the United States, well, there's really four, but in nonprofit speak, there are two. You have hospitals and you have colleges and universities. In the philanthropic sector, and using philanthropic jargon, people say eds and meds. Eds, colleges and universities, meds, hospitals. Take a look at the disintegration of colleges and universities around these United States and the exorbitant cost of getting higher education. I can certainly speak to the exorbitant cost of higher education. Why? I have 2 master's degrees. One from the University of Baltimore, one from this fine institution, Wake Forest University. And my student loans are somewhere in the $175,000 to $180,000 range. No idea how I'm going to start paying those back. Take a look at the healthcare system in the United States. And I've spoken about the healthcare system ad nauseum and at length on all of my social media outlets. And how the United States healthcare system is a for-profit cartel. And how caregivers and medical professionals employ what's called the defensive practice of medicine in order to make sure that they do just enough to not get sued by their patients. And as I've said before, and I'll say it again, the United States healthcare system, otherwise known as the Patient Protection and Affordable Care Act, pejoratively known as Obamacare, is a Republican health care plan. When Mitt Romney was governor of Massachusetts, the people of his state approached Governor Romney and said, Governor Romney, we need a health care plan. Mitt Romney consulted a right-wing think tank called the Heritage Foundation. The Heritage Foundation came back with what is called a 3-legged stool model of healthcare. The 3 legs of the stool are access to insurance, government subsidies, and a fancy rule called the individual mandate. It worked excellently on a state level because you had cost controls. As a result, there were more people participating on a state level, so it worked wonders in Massachusetts. On a federal level, it was total shambles because you have multiple ways in the United States to get health care. Multiple ways, depending on your socioeconomic status and your social status. For example, my parents are old. They're on Medicare. I don't have health insurance. One of my younger brothers is not a high-wage earner. He's on Medicaid. I have another younger brother who is retired Air Force, spent 20 years and 8 months in the United States Air Force. He is on TRICARE. And if you think Medicare is good, try getting on TRICARE. TRICARE is outstanding. It's the military healthcare system. My younger brother pays. He's married with 3 kids and he has a dog. And his wife has some compromised health issues. And he's paying $154 every 3 months for his wife and 3 kids and himself for health insurance. Basically a little more than $600 a year. If I were to buy health insurance right now, I'm not paying $600 a month. It's probably more like $700 or $800 a month for health insurance. In addition, Tyler, the social structure, the 4 institutions that every community should have, every functioning community should have: a hospital, a school, a bank, and a grocery store. The 4 institutions once again: a hospital, a school, a bank, and a grocery store. Take a look at how many people since this pandemic have been unable to buy food, and all the food pantries and bread lines that you're seeing across these United States. Kat and I did an entire episode early on in the Joe and Kat Chat series about food insecurity. And we discussed the differences between a food swamp, a food oasis, a food desert, and we didn't actually discuss this term, but I'm going to bring it up anyway, a food mirage. You're like, well, Joe, whoa. Y'all didn't talk about that in the episode. What's a food mirage? A food mirage is when you, the consumer, sees a grocery store that has fresh food options, and a grocery store that has the 7 types of food to qualify it for a grocery store. The 7 types being dairy, poultry, meat, fish, fruits, vegetables, and breads and grains and or cereals. Those are the 7 types. Now, there's all sorts of different rules that you have to have regarding refrigeration, spacing, etc. But if you have those 7 types of food that I just mentioned, technically you are a grocery store. Food mirage happens when you, the consumer, sees the grocery store, but you can't afford to buy the food at the grocery store. That is a food mirage. And we're seeing that happen in a lot of communities also, in addition to the expansion of food deserts. And Tyler, you wonder why our social structure has been poisoned for so long. There are millions of people right now who would love to get a stimulus check, but guess what? They can't cash it. Why? Because they don't have a checking account or a savings account. They are what's called the unbanked. Then there's a certain sect of those people who have a checking or savings account, but their credit is not good enough to qualify them for low interest rates or low cost financial instruments. They are called the underbanked. In addition, the underbanked live in areas where there are no financial institutions that could administer any sort of financial transactions. So what are they left to do? They're left to go to a local liquor store or grocery store to buy a money order to pay rent. Or they're going to an ATM to withdraw $20 to buy groceries, but they're paying $4 for the service fees to withdraw $20. Famous author Barbara Ehrenreich, and she's an excellent follower on Twitter, said years ago, it's expensive being poor. She also said that being poor is one long emergency.